What difference did it make to you?
Oh, it was remarkable, absolutely remarkable.
HRT's been a complete game changer for me.
So I went straight to the doctors and I said, I think I want to go on HRT. He said, are you sure? I said, no, I'm absolutely 100% sure. Give it to me.
After once being the treatment that shall not be named, HRT is everywhere. We've seen the headlines and the women's programmes and heard how it transforms your life. Better skin, better energy, even better sex. But what if you can't take HRT or you don't want to? What options are available to you? Hormone replacement therapy, or HRT as it's usually known, can be great. I've done a video on it called What is HRT, and also you can read more about it on my website 50cents.net. But for some women it's not recommended that they take it. Plus some women are like me, it takes them a while to find the right one, if they ever do. Other women find it doesn't help all their symptoms, or that the side effects are just too much for them. HRT isn't the only answer for menopause. There are other options you can try, and in fact, I'd recommend you do these as well as HRT. We all feel stress every day, especially in today's world. Family, work, aging relatives, young children, you name it, there's stress involved. Stress puts your body into the fight or flight mode, which means it gets ready to produce cortisol and adrenaline over estrogen and progesterone. And that's bad news if you're going through menopause. If you are suffering stress because of menopause, then of course antidepressants or other medications can help. But there's also talking therapies like CBT, cognitive behaviour therapy. I've done CBT and I highly recommend it. It helped me through a very stressful time when I got a major promotion. Clinical trials have also shown that it can help with hot flushes and night sweats. There are books that will help you with CBT. The British Menopause Society especially recommends one, which I'll put the link below, which is all about how to use it to manage symptoms like night flushes, like hot flushes and night sweats. CBT can also help insomnia, and it's really something that I need to do again because I suffer so much with insomnia. I've also downloaded the NHS Sleepio app and I'm giving that a try, and I'll let you know how that gets on. Oh, I know. I keep talking about the need to get active because there is nothing better when it comes to menopause and midlife than doing a bit of exercise. Numerous studies have shown how it can work to help your menopause symptoms. If you can't take HRT, or even if you do take HRT, exercise is something you should be looking at. It's been known to help with hot flushes, mood swings, and just sleep. And if you're sleeping better, you're going to cope with your menopause that little bit better. Plus, a lot of people talk about HRT as future-proofing yourself, but so can exercise. It can help cut the risk of heart disease and heart problems, type 2 diabetes. It can even help reduce your risk of hip fractures. Exercise can lessen the risk of dementias and some forms of cancer. Find the exercise you like and try and do 3 30-minute sessions a week. That'll make a huge difference. I mean, come on, don't we all want to be lionesses now? You mightn't be able to take HRT, but there are other medications out there that can help. Tibolone can help with hot flushes, low mood and libido. Some antidepressants can also help with the likes of hot flushes, such as citalopram. And clonidine can help with hot flushes and night sweats. However, these aren't suitable for all women, and no, they're not as effective as HRT, but they might give you some relief if you can take them. Some of these do have similar side effects to HRT, so do your research and be guided by your healthcare provider. Ask your pharmacist for help because they are a fountain of knowledge when it comes to which medicines you might be able to take. Then we have the complementary medicine, and it's not as woo-woo as you might think. No, we're not talking about magnets down your knickers. We're talking about the likes of black cohosh, evening primrose oil and St John's wort, which may help reduce hot flushes as well as other symptoms such as anxiety and mood swings. Lots of women contact me to say they have really good results with CBD oil as well. I can't get away with the taste of it, but that's just me. But again, check with your pharmacist because some of them can have interactions with medications you might be on, so it's always better to be safe than sorry. And if you fancy it, there are good reports on reflexology and acupuncture too. Studies show that the more you weigh, the more likely it is you'll suffer from hot flushes, night sweats, muscle pain, joint pain, and also bladder issues. Now, I know how it is. I've spent a lifetime dieting and I'm never dieting again. But I have put on a few pounds over lockdown and I would like to get rid of them. So I'm just looking at what I'm eating. So more vegetables, lean proteins, some healthy fish, grains, and a little less of the cakes and the biscuits. Although a little bit every now and then is all right. Plus also, it's not so much weight, but caffeine and alcohol have also been shown to trigger hot flushes, and so has spicy food, so that curry might not be the best idea. Now, of course, not all of these will work for every single woman. I mean, menopause is down to your own hormones, so everybody's menopause is different because your hormones are different. Things like exercise, watching your weight, and reducing your stress are all going to be good and positive things you can do to help yourself. And as I said, even if you are taking HRT, the things you should be thinking about. Don't be scared of HRT, but don't think you're doomed to suffer if you can't take it. There are lots of people out there who can help. Registered nutritionists who deal with menopause, for example, they can help. Remember, at the end of the day, it's all about choice and it's all about what's best for you. So don't feel bullied into taking HRT if it's not what you want to do. Do your research and do what makes you happy. And of course, one of the best ways to get through your menopause and your midlife is subscribing to 50 Cents. So go on, hit the button and get a bell, and that way you'll be notified as soon as my next video comes up. See you then.